All right. So, welcome everybody, and thank you for joining us for our webinar about UAB Dentistry today. And we're going to give people a few minutes to join us on Facebook and here via Zoom. And so, if you're having any difficulties, let me know. Facebook was having a little bit of an issue, but I think we're good now. So, we want to welcome everybody. Again, we'll give everybody a few minutes to join us. We are here, joined by Dr. Elise Dengler. Did I say? I hope you got your name correct.
Yes.
And we're delighted to have her today talk to us about UAB dentistry. Throughout the webinar, what we'll do is we'll have the Q&A open for you to submit your questions, and you can also send your questions through Facebook Live. So thank you very much for being here with us. And without further ado, I'm going to pass it on to Dr. Dengler to start us on our webinar.
Perfect. Thank you so much. Thank you for everyone listening live or to the recording. My name is Elise Dengler. I am the Assistant Director of our Comprehensive Care Clinic. I am a UAB School of Dentistry graduate. I graduated in 2018, and time has just flown by. It feels like it was just yesterday. I am a Birmingham transplant, so I'm originally from Tennessee, but I came to Birmingham for dental school and loved it, and I'm here for the foreseeable future. So, I'm going to talk a little bit about our school. First, just kind of an introduction, then why UAB Dentistry. And then we'll talk about the different options we have for care at our school and just some general information for patients. So we are one of the nation's premier dental schools. There is no official ranking, but when you kind of look at the strengths of our school, we have many. We offer the DMD degree. It's not any different from the DDS, but we also offer some dual degree programs. So we do have a DMD PhD, DMD MBA, and we do have different residency programs or postdoctoral programs, including the DMD MD program, which is typically for people who are interested in oral and maxillofacial surgery. We have early, extensive, and broad clinical experiences. I think that's one of the strongest parts of our school is that our students are doing a lot of dentistry. That's the best way to learn is to do it. Starting in August, our first year students are in the clinic rotating, so we don't take too long before we get in on the action. We are a top tier research institution. We have a supportive student environment. I think that one of the best things about our school is the people, and that's why I chose UAB in the first place, and that's kind of why I stayed, is that we help each other, and that's kind of the culture we have at the school. We have a wide-ranging community collaboration and service. Our students do have mandatory rotations out in the community clinics, but we also have many student groups who do volunteer work in the community as well. Our kind of catchphrase is ready day one. What that means is when our students graduate, they are immediately ready to go out in the world and practice dentistry based on the things that they've learned in their 4 years with us. That is our website. You can also scan the QR code or just Google UAB School of Dentistry. So why UAB specifically? We strive to provide quality, comprehensive, general, and specialty oral care for you and your family. So we try to treat the whole patient, and we do treat children all the way up through adulthood. So any age of people are welcome at our school. We have top-notch providers, state-of-the-art facilities and equipment, and the most up-to-date treatment techniques. So we have our research at our school that helps keep us kind of up to date, but also as teachers, I can speak for myself that I always have to stay up to date on the latest things because I want my students to also be learning the most current ways of doing things or materials to use. So we try to stay as up to date as we can and adapt with the times. We do have several different options for care, so we're going to switch gears a little bit. Um, we kind of divide it into three different buckets. And as a patient, you are able to choose whichever one you would like. So we have faculty that treat patients, we have residents that treat patients, and we have students that treat patients. So number one listed here, it says general dentistry student clinics. After that, we have the specialty clinics, which are our resident clinics, and then our dental faculty practice. Our fees are about 50% lower than private practice, and that does vary depending on which clinic you go to and what treatment that you get. But generally speaking, it's going to be about half price from a private practice dentist kind of in the outside world. So option one is our general dentistry clinic. These are third and fourth year dental students that work under faculty supervision. These are two lovely students here pictured. They just graduated 2 weeks ago, so congratulations to them. This is our most cost-effective option. So our student clinic will be the cheapest monetary option. However, I like to say sometimes you'll pay with your time. The appointments are very long. It's about 2.5 hours per appointment. Sometimes it ends quicker than that, but usually that's how long it takes. So you will be spending some time getting to know your student. We have two different clinics. We do have an urgent or emergency care clinic. That's kind of a problem-focused clinic. And then our comprehensive care clinic kind of takes you from A to Z, starting off with diagnosing your needs and doing all the treatment that someone needs. Our urgent and emergency care clinic is for dental emergencies. It is a walk-in clinic, so there are no appointments, and it is located on the first floor of our school. It is open during regular business hours. They are closed on holidays and some of our training days. That is posted on the doors of our building, but also if you check out our Facebook, they'll usually post when we're closed. There are AM and PM options. However, I would recommend that you go as early as possible. This clinic does close once the patients are done for the day. So if you walk in at 4:30, you probably will not be seen. They're probably already back at home. Outside of normal business hours, the main UAB hospital emergency department does have dental on call. So UAB does have a hospital dentistry residency, and those residents are on call 24/7 every day of the year. So say you're out on a Saturday night with friends and you rent a scooter and you hit your face on the ground, you can go to the emergency department and they can treat you then. So you do not have to wait until walk-in hours to get treatment, which is pretty great. Our comprehensive care clinic is where our students spend most of their time treating patients. This is multidisciplinary and faculty supervised. So a faculty member is going to check every step of the way while the students are working. We do general and restorative dentistry. So we do cleanings, fillings, dentures, crowns, so most kind of basic things that people would need. Our first appointment is to develop a treatment plan. So if you call the school and say, hey, I want to be a patient, they're going to schedule you an appointment for treatment planning. That is where we do all of our x-rays. We do a really, really thorough clinical exam and kind of make a plan for whatever you need. Patients are then assigned to a student for every subsequent visit. So once you're a patient here, you stick with your student unless that student graduates and then you get reassigned. But the whole point is that you're not kind of bouncing around to a different student every time, that you get assigned to the student. And our patients love our students. I love them too. That's why I work at the school, because you will get to know them after multiple appointments. And then that way you can have a nice relationship with someone who knows you and knows your mouth. So if that sounds interesting to you, you can call this number on here. It is June 12th, so we are currently on our summer break, but the school is still up and running. So we still have our emergency clinic and we still have our treatment planning clinic over the summer. So the students do have breaks throughout the year, but generally we keep going because people always need a dentist. Our option two is our specialty clinics. So these are our resident clinics. So a dental resident is a person who has graduated from dental school, and then that person wants to pursue further education. So that can be a specialty or it can be general dentistry, just wanting a little bit more practice. So this picture here, these are, that's Dr. Cow. He's the head of our orthodontics department. So we do braces at the school if that's something that you're interested in. And these would be residents treating you as a patient. So the cost is a little bit more than in the student clinic. It is still less than private practice. So we say about 75% here versus 50% in the student clinics. The appointment lengths are also kind of moderately long. Again, it depends on what you need and what they're doing that day, but they tend to be a little bit faster than students. And some of these things you have to see a resident. So students do not do braces. It would have to be a resident treating that, for example. Some of our specialty clinics do require a referral. That's not to make it more complicated or difficult, but we just kind of want to make sure that everyone's going to the right place. So you may have to start in our treatment planning clinic before we kind of send you where you need to go. But just so you're aware, typically with the resident clinics, it does require some sort of referral, and you can't just walk in and say, hey, I want whatever done today. We have all of these different specialties listed. So we do root canals, we do implants, we do dentures, we do extractions, we have braces, pediatrics. So we pretty much do it all. And that's another great thing about UAB. And most of it's in the same building. So as long as you can make it to the corner of 7th and 20th Street, you can usually get the care that you need. The third option is faculty practice. So these are faculty members like myself seeing our own patients. And this is going to be most like the private practice that maybe you're used to kind of out in the world. This option does cost the most. You are getting the most experienced practitioners. However, the appointment lengths are shorter. This is our phone number for the UAB Dental Group, which is our faculty practice. We do cleanings, fillings, crowns, implants, pretty much everything here. Again, we have all kinds of specialists in our building, so you're probably going to be getting one of the best dentists in the state doing your treatment. And this functions just like a practice. So you would call, make your appointment. We do have hygienists, we have dentists, so this is probably the most like what you're used to in terms of private practice. We do have something called student dental health. This is available to students in the School of Dentistry, Nursing, Medicine, and Optometry. As a student, you are automatically enrolled in this. As a student of those schools specifically, you'd be automatically enrolled in this unless you provide proof of dental insurance. So the purpose of this program is to act kind of as a safety net for uninsured students. Cleanings and fillings, and I think it's like $39 a semester. The director told me, I was talking to him this week about it, but they do cleanings and fillings and then can make referrals for any advanced care. If that applies to you and you are interested, you can call the number or email angela64@uab.edu. I just Googled UAB student dental health and there was a whole big pamphlet. I felt like that was overwhelming to put on this presentation, but if you want more information, you can again Google it, UAB Student Dental Health, and you can find the pamphlet that has even more information. I just wanted to make sure to mention it in case this applies to you or your student. Okay, payment and insurance. This is a big question that we get all the time. We accept cash, check, or credit card. We are in network with 2 providers, so Blue Cross and Blue Shield of Alabama and MetLife. So for those providers, we can bill your insurance directly. For any other out-of-network insurance companies, we do what we call a courtesy claim. So we can give you the documents, file with your insurance, but you still would need to pay out of pocket and then get reimbursed by the insurance company. This applies to our student clinics and to the resident clinics. For faculty practice, that is a separate thing. Each provider in faculty practice decides which insurances she or he would like to accept. So there is a little bit more leeway there. But in the student clinics and resident clinics, we are only in network with Blue Cross Blue Shield and MetLife. So if you have a different kind of insurance, we are still happy to see you and can help you file that. But you would have to pay the school upfront and then get reimbursed by your insurance company. We are approved for Medicare and Medicaid, so those are 2 other that we can file directly with Medicare and Medicaid. Parking. Downtown parking is difficult for everyone. That includes us. This is a map. I just took a screenshot on my phone. The blue dot is the dental school. So we are kind of sandwiched between 19th and 20th Street, and then 7th Avenue South and University, which is 8th Avenue South if it were a number. So we are on a very busy block. There are different parking options around, and then we do have our own dedicated parking lot where the green arrow is pointing. Um, this is something that has been a really good thing to help our patients get to us a little bit easier. There is the University Boulevard parking deck, which is right on University next to the Hilton. There's street parking. You can use public transportation, and then our website has more options. But parking is something that can be difficult for anyone downtown. But we do try to help as much as we can provide options for our patients. We have quite a robust research program, and I know that I didn't know much about it until I came to UAB and they told me, but if this is something that is interesting to you, I would encourage you to take advantage of it. We do have master's degrees and offer a DMD PhD dual degree. We do have summer research partnerships. So if you are interested in some kind of dental related research, they do have summer partnerships. And every year we have a scholar symposium. So our students are required to do some sort of research project while they are students. So I still remember mine. And then they present every year about February, March time. They all do their presentations. So it is something that is important to advance our field, to improve our knowledge. So it's integrated into our curriculum as well. We do have 5 different research themes that are listed there at the bottom. So it's quite a broad number of different topics and research interests and things like that. So we do have a Facebook, it's uab.dentistry, and we have an Instagram, UAB School of Dentistry. They typically will update the Facebook with kind of more like scheduling updates. Like I said, if we're closed, it should be listed on the Facebook. And then our Instagram is more fun stuff. So they'll put up fun pictures of our students and cool things that they're doing. So it may not be as informational on Instagram, but it's a little bit more fun. So if you want to learn more about us, you can look on our website, you can look on our Facebook. We do sometimes have to close for weather. The information's out there, so it's either our website or Facebook or something like that, but we try to communicate as much as we can so that people can get the care they need. All right. If anyone has any questions, I'm happy to answer them to the best of my ability.
Awesome. This is great information because I know sometimes families worry when their students are away from home and they've been seeing a specific dentist for a very long time, or they have braces or transitioning from braces out to retainers, or if in the unfortunate event that there's something that involves their
Mhm.
teeth, a little accident or something, there's assistance that can be provided here at UAB. So we wanted to share this with families so that they know what's available, they know how insurance works, and they can contact UAB Dentistry in case they have any questions. And thank you also for sharing some of the more academic aspect of the program in case families or students are interested in pursuing that as well. I'm monitoring for questions. You're welcome to put your questions in the Q&A section or on Facebook. And thank you for joining us also on Facebook. We had a little bit of technical difficulties, but it's working well. And so we're excited that you were able to join us. Again, the recordings will stay live on Facebook, and then we will post them on our website, uab.edu/families, within a week with captions. So if you weren't able to stay for the whole time, or if you want to see it later, share it with other family members or with your student, you will have the opportunity to do that. I'm not seeing any questions right now. So is there anything that families need to keep in mind, or any last minute recommendations that you would like to give families, Dr. Dengler?
You were asking me before we started if there's any kind of fast tracks or scholarships or kind of things for undergraduate students to kind of get into the dental school. We do have a couple different programs. If someone's interested in that, I would recommend looking at our website under admissions. That will give a lot more information. I don't know that we have a fast track program itself, but the people in the admissions office can certainly answer questions. I know a newer thing that we have is a rural scholarship program. So that is one way. It's students who they have a 4-year commitment after dental school to go work in a rural area in Alabama. But it's a great way to get your school paid for, and then you go and work afterwards. So you're still making money immediately upon graduation. So maybe for someone who maybe military is not an option, that's another newer scholarship that we have available. But I think that the UAB, like undergraduate dental, pre-dental society is pretty active, and we love having people ask questions, and our students are always really eager to share and kind of recruit more people to come to the school. So, and some undergraduates do research in our lab, so there's a lot of ways to get plugged in before you get here.
Well, this is very helpful because we had some of our family members who have come through orientation. And I know it's early in the planning process, but it's not early to start thinking about, future
Mhm.
plans. So they were inquiring about how a student could progress from undergraduate into dentistry. So this information that you've provided is very important in case families are interested. And so just feel free to reach out to the School of Dentistry and check out their Facebook page and also undergraduate admissions for dental school. So I'm still monitoring here, but we don't seem to have any questions, and that's okay because sometimes questions come afterwards, or as you talk to your student will be like, have the question of, oh, I never thought of, going into UAB dentistry. And this is something that, you now have the information, you can share it with them, pass it on to other families and explore what's available for students. So if any questions come up later, feel free to send them to families@uab.edu, and then we will be channeling those to Dr. Dengler for answers. And if you have any other questions or anything else that we can help you with as you transition your student or as your student progresses through their career here at UAB, just let us know. But I'm going to take this opportunity to also, in addition to thanking Dr. Dengler for being with us today, just to make a little commercial about tomorrow's webinar about student health services. And so they'll talk about immunizations, they'll talk about insurance coverage. So it'll be a great opportunity if you can join us tomorrow at noon. It'll be again here live on Facebook or on Zoom. So again, I'm not seeing any questions, but if any come through, we'll be glad to pass them over. And thank you again, Dr. Dengler, for being with us today. And we wish everybody a great rest of your afternoon. And we hope you can join us tomorrow. Have a great afternoon, everybody.
Thank you.